Hi everybody, my name's Renee. I'm the dietitian here at WellSpan Bariatric Surgery in the Ephrata office. And today I'm going to be going over the information for your first class, which we call the initial class. Now normally you would hear this information in person in a class, but however, since we're not allowed to have classes right now, we'll be doing this through video. So this class will be separated into two videos, about 30 minutes each. So you can take your time to watch those. You can watch it more than once if you would like, whatever works for you. So hopefully at this point you've received the information either by picking it up here at our office or through your mail or email. And that's what we're going to be going through today. So if you have that with you, go ahead and pull that out, open it up, have it in front of you. That way you can kind of follow along. Now, this packet of information is pretty extensive. It's about 34 pages, so there's no way I can touch on absolutely everything in this packet today. So what I would encourage you to do is at some point in the following weeks or in this next month, if you can go back through this and read it, just so that you can review this information and reiterate it so that you feel most comfortable. Now, the downside of doing this video is that you can't ask questions as we're going through. So if you have a pen and paper, try and write down some questions you have, and I'll give you a call after you watch this video. That way I can check in and answer any of those questions that you have. You're also welcome to call our office at any point and we can review that together. So go ahead and open up the paper. We're going to be starting right here where it says nutrition guidelines for the different surgeries. And I'm actually going to have you turn to page 4. That's where we're going to start today. So I want to start the class with a few key behaviors. Now, as we go through this information, you're going to find that a lot of things will be important after you have this surgery so that you stay healthy, you stay successful, you stay safe. But these 4 things we have found are especially important. So the first thing on the list is consuming 64 ounces of fluid daily. It's very important to stay hydrated after surgery. However, at the beginning, the first few weeks, first month or so, it can be a real challenge to get your fluid in. And we'll talk about that in a minute here. But it is so important that you get what you need so that you stay hydrated and you don't develop dehydration and then end up in the hospital. We're going to want that fluid to be primarily water, but we will discuss a few other options as well. The second thing on the list here is consuming 60 to 70 grams of protein every day. So protein is one of the 3 macronutrients. We have carbohydrates, fat, and then of course protein. So protein has a lot of benefits after surgery. It helps with healing, which after surgery, everybody wants to heal as smoothly as possible. It also helps maintain your muscle mass. It helps decrease hair loss. It helps keep you full in between your meals so that you're not as tempted to snack. Those are just a few of the many benefits. So that is something that we will push a lot, and we'll talk about that as we go through the class today. The third thing on the list is taking your vitamin and mineral supplements daily. So after surgery, you're only going to be eating very small portions, and it's really impossible to get everything you need from food alone. So that's why we have you take additional vitamins. And we'll go through exactly what you need. And when eventually you're able to come back into the office, we will give you samples and make sure you're all set up so that you have what you need. And the last thing on the list here is planning out your meals and your snacks. So we have found, and studies have found, that people who are thinking ahead, they're planning ahead, they're prepared with what they're going to do, are successful short-term, but also long-term when it comes to weight loss. So that is something that we really encourage. And if you're not much of a planner now, that's not a problem. We will help you work on that and develop those skills. So those are just 4 of the key behaviors. Like I said, you're going to learn a lot other behaviors as well that are important, but these ones are especially crucial. So staying on page 4 here, let's talk about fluid. You can see there's a blank line there that says daily fluid goals. So go ahead and write in 64 ounces daily, which is the same thing as 8 cups. With our fluid, like I said earlier, we primarily want that to be water, but all of the fluid needs to be calorie-free, non-carbonated, and decaffeinated. The reason for calorie-free is probably fairly obvious. If we are drinking our calories, that's going to make it a lot harder for us to lose weight and maintain our weight loss. So things like soda pop, coffee drinks with lots of flavorings, sports drinks, energy drinks, those things we all want to really cut out from our diet because those are contributing a lot of calories and a lot of sugar that our body doesn't need. The second thing with our fluids is non-carbonated. So after surgery, your stomach is going to be a lot smaller than it is now. And the carbonation, those bubbles that come from the carbonation, can't expand properly in the new stomach. So it causes a very uncomfortable feeling, and it's better just to avoid that entirely. And then the last option, or the last thing we have here is decaffeinated. So this is primarily for the first 3 months after surgery. Caffeine can be very irritating to the surgical site. It can cause inflammation, damage, ulcers, all things that we want to avoid. So I know that this can be a challenge for some people, especially if you're used to having caffeine on a daily basis. What I would encourage you to do is work on cutting out that caffeine now. So if you're used to drinking, let's say 2 cups of coffee in the morning, this next week try 1.5 cups. And then slowly work yourself down so that the caffeine is out completely. If you wait until right before surgery or the day of surgery to not have, or to cut it out, you're gonna be dealing with caffeine withdrawal, and you don't really wanna have to deal with that on top of going through the pain of a surgery. So once you get through those 3 months, it's okay to add a little caffeine back in. Really, I would limit it to about 8 to 12 ounces a day if you do choose to add it back in. And the reason we say that is because caffeine can be dehydrating and it can cause you to have to pee more often, which that would dehydrate you. And if you remember, one of the main things we want you to focus on is staying hydrated. So even once you're able to have those caffeinated beverages again, we're still going to want to limit them, okay? So again, the goal for fluid is 64 ounces a day. Now, as I said at the beginning, that can be a real challenge to get all of that in. So right now, if I gave you a tall glass of water, you would be able to drink that, really no problem. That shouldn't cause you any pain. It shouldn't be an issue because your stomach can expand and can hold that fluid. However, after surgery, your stomach is no longer able to expand like it can now. So if you were to drink a lot of water at once, it's not going to be able to go all the way down to your stomach. So it's going to sit here almost in your chest. You might throw it back up, you might feel sick, and that could cause a lot of pain. So it is very important to sip your fluid very slowly throughout the day. And we'll talk about those guidelines in a little bit. So once you wake up in the morning, we want to start sipping on fluid. So you want to get used to always having a water bottle with you, a glass with you, so that there's a visual reminder to continue to drink. If you wait, let's say 3 to 4 hours after you get up to start sipping on your fluid, there's really no way you're going to be able to get all those 64 ounces in, and that's a quick way to get yourself dehydrated. So again, this is something to work on if you're not used to drinking throughout the day or carrying water with you. Try and focus on that and see if you can get that 64 ounces in. Another challenge with the fluid is something that we call the 30-30-30 rule. So this has to do with your food and your beverage intake. We don't want those two to mix because it can cause pain, damage, vomiting, all sorts of complications. So that first 30, what we want you to do is 30 minutes before you eat a meal, stop drinking. So let's say your lunch is at 12 o'clock. At 11:30, you're going to want to stop all fluid. The reason for that is it takes maybe about 20 minutes or so for fluid to work its way through our stomach. We don't want your stomach full of fluid right before you're about to eat, because you're not going to be able to eat much. And also, again, that fluid and food mixing can cause some pain. The second 30 is we want 30 minutes per meal. This is probably one of the hardest things for people after surgery, just because you're eating such a small portion, and 30 minutes can feel like a very long time. This one is important though, because typically it takes about 20-25 minutes, maybe longer, for our stomachs to signal our brains that we're full and that we've had enough. So let's say after surgery, you're only taking about 10 or 15 minutes per meal. Well, you might not have that signal between your brain and your stomach telling your brain that you're full. So if you overeat, even potentially one bite, that can cause you to be sick. As I said earlier, your stomach can't really expand anymore to hold the food. So if you take a few extra bites, you're going to throw it right back up, which I'm guessing not many people want to do. So that 30 minutes is very important. Again, if you are a quick eater now, that's okay. This is something to focus on and to work through now. Time yourself when you eat, put your utensils down, hold a conversation, whatever you have to do to slow yourself down, try and get in that habit now. And then the last 30 is waiting 30 minutes after a meal to have a drink again. So right there, that's 90 minutes, and we want you to do at least 3 meals a day. So that's 3 90-minute blocks during the day that you're not drinking. So again, that's quite a challenge to get in those 64 ounces if you're not really being mindful about that. All right, and the last thing we have on here is that we do not recommend straws. Sounds kind of silly, but the reason for that is when you drink out of a straw, you're drinking in air without really realizing it. And that air can get trapped in your stomach and cause really bad gas pains, can be uncomfortable. So it's best to just avoid that completely, okay? So the bottom of page 4 here has a list of recommended fluids for you. It doesn't necessarily have to just be water all the time. You can add certain things like Crystal Light. You can do Gatorade Zero, Powerade Zero if you like a little flavor. Mio, different things like that. But really, like I said, calorie-free, non-carbonated, and decaffeinated, okay? One more note about the fluid here is the alcohol use. We strongly discourage alcohol before 6 to 9 months if you do choose to add it back in. There are a few reasons for that. The first thing is that it's going to cause extreme stomach discomfort and pain. Things that you do not want right after you had stomach surgery. So you're going to want to be very careful with that. Another change you'll notice after surgery is that alcohol is metabolized very differently. So you'll feel the effects right away from a very small amount. Alcohol is also high in calories and can potentially lead to weight gain. So you're not going to want to have it consistently, even when you can choose to add it back in. So the first time you do choose to have alcohol after surgery, once you're in that safety zone of at least 6 to 9 months, be sure to have somebody with you, and I would encourage you to be at home. That way they can make sure you're safe, you can make sure you're safe. So again, 6 to 9 months at least if you do choose to add that back in, okay? All right, moving on to protein on page 5 here. At the beginning of class, I mentioned some of the benefits of protein, and the goal of protein after surgery is 60 to 70 grams, which you can go ahead and write that in on page 5 here. So goals do vary based on your height, your gender, physical activity, but in general, 60 to 70 is the good starting point. We have a lot of people actually exceed that amount, which that's perfectly fine. So the best sources of protein are going to be through the meat and dairy food groups. However, if you are a vegetarian and you don't eat some of those things, that's fine. We will make sure that we find a way for you to get all your protein in. So look at page 5 here. We have a list of all the different protein sources and how many grams of protein you get per serving or per ounce. So if you're really unsure of where your protein comes from, read through this page. It gives you a whole list of things you can try. It tells you what you're getting out of that as well. We'll talk about protein shakes and protein supplements in a little bit here, but those are really beneficial. Again, the first few weeks, month after surgery, some people continue those even longer than that because they help you really get what you need, okay? All right, page 6 and 7 goes over the information on the vitamins. I'm not going to spend a whole lot of time and go through all of this right now, but when you come into our office, once all of this is over, we'll go through this again and I'll give you samples and make sure you know exactly what you're going to do, and we'll find a plan that works best for you. But again, these vitamins are important because they do prevent nutrition deficiencies, which we definitely don't want. So these are something that you will do for the rest of your life. Now that may change. Dr. Marone will have your blood work checked periodically, and based on that lab work, you may need to take things away or add things in, but we will help you through all of that. The first 3 months after surgery, we want everything, for the most part, to be chewable, dissolvable, liquid form. We don't want any major or any big pills getting stuck or upsetting your stomach. Okay, there's a few more guidelines on 6 and 7 here that show you, based off what surgery you're going to have, what vitamins you need. So for the most part, you're going to need a multivitamin, vitamin B12, vitamin B1, calcium, and iron. Now, some multivitamins contain a few of those things. So, you know, there's different options here. And again, we'll work through all of this. We'll make sure you understand it. We'll give you the proper tools so that you can decide what works best for you. Alrighty, turning to page 8 here, we're going to talk about the dumping syndrome. So some of you may have heard about this before, maybe from someone you know who's had the surgery, but dumping syndrome occurs primarily in patients who've had the gastric bypass surgery. What happens in the dumping syndrome is typically after someone eats something high in sugar or high in fat. So think of things like cake, candy, desserts, fried foods. There's a whole list of foods here on page 8 for you. But the new stomach really can't handle that. So what happens is it dumps it down into the small intestine. The problem is that the stomach didn't really do its job. So the food hasn't been properly digested. And because of that, the body wants to get rid of it as soon as possible. So the intestine pulls in all this excess fluid, and you have these symptoms: gas, cramping, bloating, diarrhea, fast heart rate, sweating. From what I understand, it's pretty miserable, and it's going to come on pretty quickly. And you'll know when it's happening because oftentimes you'll have to rush to the bathroom. So it's really very important to be mindful of what you're putting into your body and making sure you're avoiding these foods. Now, like I said, primarily this happens in patients who've had the gastric bypass surgery. However, if you've had the sleeve, you can still experience symptoms like this after foods high in fat and sugar. So for the most part, you're going to want to avoid those things. Now, everybody is very different with how they tolerate foods. So I've had patients before who have had their gastric bypass surgery and have never experienced this dumping syndrome. Other people, even 5 years later, certain foods will trigger this. So it is something to be cautious of and very careful of. We'll talk about this more as you come into the office. We'll make sure that you know exactly what to look for, okay? All right. Bottom of page 8 here mentions lactose intolerance. So lactose is present in our dairy and our milk products. So cheese, yogurt, milk, ice cream, anything that has those products in them. And occasionally, as a result of weight loss surgery, this intolerance to lactose develops. So there isn't enough the body isn't producing the right amount of the enzyme lactase, which helps digest that, and that's why people have an issue. So if you think you're developing a lactose intolerance, after you have a milk product, you may notice symptoms of gas, bloating, and diarrhea. This doesn't happen to everybody, and more often than not, I see people have issues with milk, but not so much cheese and yogurt. And that's not even everybody, again. And I can't really tell you now if you'll have that issue or not. That's something that you'll determine as you're working through everything after surgery. So there's no real treatment for this besides avoiding those lactose-containing products. Thankfully, there's a lot of different options out there. So there's plant-based milks like almond milk, there's soy milk, there's the lactate products, which just don't contain the lactose. You can take a lactate tablet, which would help you digest it. And those are just some of the options for you, okay? All right, so now we're going to move into talking about how you're going to advance your diet after surgery. We have you follow a very specific plan, and this is 100% for your safety. So we have to advance your diet slowly so that you don't develop any issues, you don't get sick. Nobody wants that. So it's so important to follow this exactly as we tell you. If you do that, then you will majorly decrease your chance of complications. So I'm going to go through first what the different stages are, and then we're going to dive a little deeper into each of those. So we really have you follow 5 different diet stages, and each of them are different periods of time. So you will start off in the hospital with clear liquids, and that will only last while you're in the hospital. Once you go home, you will start your full liquids. That goes on for 2 weeks. You'll do pureed foods for 1 week. You'll do soft foods for 2 weeks, and then you'll be into a more regular diet. So let's talk about what each of those stages entails. Starting on page 11 here, we're going to go with the clear liquids. So most often this stage will start your day after surgery. And again, it only lasts while you're in the hospital. At this point, from a nutrition standpoint, the main goal is to keep you hydrated. So the fluid goal is 64 ounces. Now, I don't think there's many people who are able to achieve that right away, and that's perfectly fine. We don't expect you to be perfect, to get that in, but it's a goal, so we want you to work towards that. So again, you're going to need to be sipping constantly throughout the day. A good goal is about 1 ounce every 15 minutes or 4 to 6 ounces an hour. So everybody has probably seen those liquid measuring cups that come with liquid medication. That's about 1 ounce. And I believe that they will give you that in the hospital so that you can actually measure out your fluid and stick with that 1 ounce at a time. Even that 1 ounce should last a few sips. It shouldn't be, you know, like a shot. You take it all at once. You want to do that very slowly, okay? If you notice you're feeling overly full or you have nausea or vomiting, it's okay to stop and give yourself a break. At this point with your vitamins, we're only going to want you to start vitamin B12 and vitamin B1. I'm not 100% sure if they give you that in the hospital or if that really is something that you start when you get home, but we can check on that for you if you have questions about that. Your beverages in this stage will have color, they can have flavor, but you have to be able to see through them. That's why they're called clear liquids. They also have to be sugar-free, decaffeinated, and non-carbonated. The nice part about this stage is that you're going to be in the hospital, so they'll be able to bring all of these fluids to you. But here are a few pictures of the clear liquids that you can have. So you can do sugar-free Jell-O, even as Jell-O in its Jell-O form. You can do different kind of broths, sugar-free popsicles, decaf coffee and tea, but you can't have any milk or creamer. You can do flavored waters, you can do Crystal Light, you can do Neo, Gatorade Zero, Powerade Zero, any of that is fine. And you'll notice you have a list here on page 11 of what you can do. So again, the primary goal is just staying hydrated and sipping constantly throughout the day. So you're going to want to check in on yourself, make sure that you're not dehydrated. If you look at this important information section on page 11, at the very bottom, it discusses the signs and symptoms of dehydration. So a really obvious one is the color of your urine. If you notice that your urine is very dark, that most likely is an indicator that you're dehydrated. So be aware of that. The nurses will be checking in on you, but that's something to watch when you go home as well. The bottom of page 11 here has a sample meal plan. So it kind of shows you how each hour can break down what you can include in your clear liquid diet. If you think that just water, Jell-O, and broth are going to be what you'll stick with, that's fine. You don't have to do all of these things, but it gives you a good idea on how those can break down. So that's your first stage. Again, that's pretty short. It may be less than 24 hours. So as soon as you go home, you start this next stage, which is the full liquid diet, all right? This one is for 2 weeks. So at some point during these 2 weeks, you're going to be back in the office meeting with Dr. Marone and one of the dietitians. So we'll be checking in, seeing how you're doing with your protein, your liquid, how you're tolerating things. And then, of course, you can call us at any point too if you have questions. So at this point, we're still focused on our fluid goal of 64 ounces. And the way that we divided out this stage is we said shoot for 32 ounces of the clear liquids. So water, broth, jello, all of the stuff that you had before you can continue to have. What's new is these 32 ounces of full liquids. These full liquids are what's going to provide calories, nutrients, and protein. So these are very important to get in, okay? The sooner you get your protein in, your calories in, you're going to start to heal and feel better. Protein goal, again, is 60 to 70 grams. If you're not able to reach that the first few days you're at home, that's okay. But again, we want you to do the best you can. I see it time and time again. People who are getting close to that 60 are starting to feel better, and it really does make a difference. We're sipping constantly throughout the day, still about 1 ounce every 15 minutes or 4 to 6 ounces an hour. We don't want you going over 8 ounces an hour. The liquids here on page 12, the clear liquids are on here, which again are all the same. The full liquids are what's new. So this is about half your intake. So let's look through those. So some things you can do blended and strained bean soups or cream soups, as long as there's no chunks of food in them. You can do milk, so 1% milk, skim milk. You can do Fairlife milk if you've heard of that before. You can do soy milk, lactate, any of that is fine. Sugar-free hot chocolate made with milk, sugar-free pudding, protein shakes, which I'm going to talk about here in a second. And then another thing you can do is thin down yogurt. So Greek yogurt especially is high in protein, and that is an excellent thing to include in your diet. Now, you probably don't really consider yogurt as a liquid, so you're right, it's not really a liquid. But what we would suggest you do is add a little water or milk to it to thin it down a bit so it's not as thick, okay? So turn to page 13, and then we're gonna talk through pages 13 through 15 here. I already mentioned protein shakes are really beneficial and they really help people reach their goals. So page 13, we lay out some guidelines when it comes to purchasing protein powders or protein supplements. So the first thing here is we want you to choose a whey protein. The whey protein is going to be the best absorbed, and there's 2 different options. So there's a whey protein isolate and a whey protein concentrate, and this will tell you, or whatever protein you're getting, it will say right on the label or right on the packaging what kind of whey protein it is. So a whey protein isolate does not contain lactose. So if you are lactose intolerant, this is the option for you. Whey protein concentrate usually has a mix of lactose, or it might contain some lactose. So if you don't have a sensitivity to that, then this one should be fine. You always want to check how much protein is in the powder or the shake. We want you to get at least 20 grams of protein so that you can really get the most out of the supplement. If you're getting a powder or you're getting a pre-made shake, check the sugar as well and try and get under 10. Shakes, powders, they can be found pretty much anywhere. Amazon sells them, CVS sells them, Walmart, grocery stores, Costco, BJ's, Sam's Club. Again, pretty much anywhere you'll be able to find these. So the next few pages, pages 13 through 15, we've laid out different recommended powders and shakes. So it tells you the name of them, who makes it, the protein type, the protein content, the sugar content, and where to buy it. There are about 1 million different brands out there. So maybe you already have a protein shake you like, or someone has recommended one for you and you don't find it on these pages. Doesn't necessarily mean it's not appropriate. what we would want you to do is just look at the guidelines. Is it a whey protein? Does it have at least 20 grams of protein and less than 10 grams of sugar? If you're unsure, just give me a call and I can look into that for you and let you know. Note on the bottom of page 15, there is a do not use list. So you'll notice things like Boost, Ensure, some forms of muscle milk. These protein shakes here, they may be low in protein. A lot of them are high in carbohydrates and calories, so those we are going to want to avoid. All right. So again, here are some pictures of appropriate full liquids. If you'll notice in that top row, the second over from the right, there is a protein shake there called Premier Protein. That one is probably the most popular one among our patients. If you'll notice, if you can see the small print there, there's 30 grams of protein per 11 ounces. That's half of your needs for the day. Yes, that might take you about 2 hours to drink, but it's pre-made for you. It has a screw-on lid so you can stick it back in the refrigerator if you can't finish it, or if it isn't as cold as you would like. But things like that are a really easy way to get in what you need. All right. And then page 16, you'll notice there's 2 sample meal plans for you, so it shows you how a full liquid day can break down. All right, we are going to stop the first portion of the video here, and we will pick up on page 17 in the next video.